Virtually every one of us will need the services of a hospital at some point in our lives. In the United States, about 1 in 5 adults visits an emergency room each year. Unfortunately, cybercriminals target hospitals and other healthcare providers every day. Some of these threat actors are even government-sponsored. Hi, I'm Marcus Christian. Welcome to the Cyber Sidebar. According to the U.S. Department of Health and Human Services, the number of major data breaches affecting healthcare victims increased by 250% over the past 5 years, and at least 4 or 5 significant cyber incidents impact the healthcare and public health sector each week. One study indicates that ransomware criminals impacted more than 280 hospitals in 2022 alone. Not only do these attacks threaten to expose sensitive information such as diagnoses and treatments of mental and physical health conditions, they also threaten safety and lives. Imagine even having to think about bypassing the closest hospital during an emergency because it is responding to a ransomware attack. One impact of the recently released U.S. National Cybersecurity Strategy is that regulatory requirements will grow, and so will enforcement. The HHS Office for Civil Rights enforces the HIPAA privacy, security, and breach notification rules. Since 2017, the OCR's enforcement staff has decreased by 45%. To reverse this trend, HHS's 2024 budget request seeks funding to increase the OCR's workforce by nearly 150%. Among other things, HHS OCR would use additional enforcement staff to address its backlog of investigations and to launch new ones. But more investigations are but one development on the horizon for healthcare entities. Regrettably, increased cyber attacks are another. For all of us, the bottom line is that we need to raise our level of preparedness. As patients, we need to keep personal health records, especially if we have chronic health conditions. Studies have shown that people who maintain personal health records enjoy better health outcomes. That is even more true when our providers' data are encrypted or corrupted by a cyber attack. And for healthcare organizations, increased cybersecurity investments will be needed to meet heightened regulatory and enforcement activity. When these elevated regulatory and enforcement efforts are to begin will depend, at least in part, upon the fate of the Department of Health and Human Services 2024 budget request. However, cyber criminals are not waiting on Congress to act, and neither should we. I'm Marcus Christian, and I thank you for watching the Cyber Sidebar. Be well, stay safe, and make a positive difference in the lives of others.